Thank you, Congressman Jeffries. Thank you, Congresswoman Clarke. Thank you for all the fierce advocates in this room here to defend Medicaid. It's my honor to start this ceremony and introduce Congressman Jeffries on this very important topic. You know, being poor in America is really difficult. It's really hard. It's really hard. But one thing that provides stability and hope for people going through that is Medicaid. Threatened cuts to Medicaid sow fear across our country. It sows fear here in the inner city. It sows fear in rural counties of New York City. It doesn't matter if you're a red state, a blue state, everywhere. Everyone in America is affected by Medicaid cuts. So I'm very honored to introduce Congressman Jeffries, who is the House Minority Leader. He's been a great advocate for health equity, for mental health initiatives, because I'm a psychiatrist, and for the safety net hospital system that provides hope and care for people who really need it.
Thank you. Good morning, everyone. Thank you, Dr. Hershberger. Thank you to the chairman, the entire Interfaith Medical Center team, as well as the One Brooklyn Health team for all of the tremendous work that you do on behalf of the people that Congresswoman Clarke and myself are privileged to represent here in Central Brooklyn. I want to thank George and the SEIU family for all of the incredible advocacy and work that you do, 1199 family, of course, Michelle, to Neisner as well, to all of the advocates, to the Reverend Dr. Waterman, who was here. This is a moment that we need prayer and leadership from the clergy as well. Republicans have proposed the largest Medicaid cut in American history. It will devastate children, families, people with disabilities, older Americans, women, and everyday Americans in this community, in the city of New York, and across the country. Why have they proposed the largest Medicaid cut in American history? It's because they want to pass massive tax breaks for billionaire donors like Elon Musk and wealthy corporations. It's unacceptable, it's unconscionable, it's un-American, and together we're going to do everything we have to do to stop these cuts from ever taking effect. We're going to hear from a variety of different individuals who will personally be affected by these cuts and or have the people that they care for be impacted and hurt by this Medicaid cut that has been proposed. All across the country, we're having a Medicaid Day of Action to save Medicaid. Here in New York City, in New York State, in blue states, in purple states, in red states, all across America. Medicaid is health care, and we believe that in the United States of America, health care is not simply a right, it is a privilege that should, not simply a privilege, it is a right. Making sure y'all are paying attention. Medicaid is health care. It's health care for the people in this community, in this city, in this country. And it is not simply a privilege to have health care in the United States of America. It is a right. And we're going to fight to make sure that that right is alive and well and save Medicaid in the United States of America. It's now my honor to introduce my sister, who represents the neighboring congressional district. We're in the 8th congressional district right now in Bedford-Stuyvesant, and the Interfaith Medical Center is such an important part of healthcare in this community. For the Bedford-Stuyvesant people that I represent, but also for the people of Central Brooklyn that Yvette Clarke represents right across the street in Crown Heights in the 9th Congressional District. She's also the chair of the Congressional Black Caucus, Congresswoman Yvette Clarke.
Yes. Greetings, Greetings and good morning, everyone. As has been stated, I'm Congresswoman Yvette Clarke, and I proudly represent the people of the 9th District of New York, and I am chair of the Congressional Black Caucus. Let me thank my leader, the Democratic leader in the House of Representatives, Hakeem Jeffries, for today's press conference, and to all of the advocates, professionals who stand with us as we say no cuts to Medicaid. We all know why we've gathered here today, and that is to address the partisan spending bill congressional Republicans passed that represents an extremely direct, extremely dangerous attack on veterans, families, seniors, and everyday New Yorkers. We can call this attack what it is with certainty because it is an assault on health care of our neighbors that depend on it just to live. Health care in our nation was promised to them. And so I'm proud to stand at Leader Jeffries' side for this Medicaid Day of Action, just as I am proud to call myself a colleague to Democrats across this nation who are speaking the same message we are today, relaying the same dangers of this spending bill and standing for the same people and families it will hurt. I also serve on the Committee of Jurisdiction for Health Care in the House of Representatives, the Energy and Commerce Committee. And we have been sent a mandate essentially to cut $880 billion from the federal budget in order to provide space in the budget for the trillions of tax cuts to the wealthiest in the United States of America. This is a humanitarian crisis. And unfortunately, there is a move afoot to make sure that we all are impacted by these draconian cuts. We've engaged in this national mission to speak to millions of Americans across the country who have lived good, decent lives, the people who are now at risk of losing their health care and housing, safer communities, and retirement security due to the cuts made by those who haven't come close to the same standard of decency. In the face of this latest scheme to slash Medicaid, Medicare, and Social Security to pay for tax breaks for billionaires, know that House Democrats will use every tool at our disposal to stop this devastating scheme, but it requires all of us. It is clear that Republicans have put a bullseye on the most vulnerable Americans among us, and we will not sit down and stay quiet while they do. In New York's 9th District alone, the community that I've called home my entire life, cuts to Medicaid will severely impact over 65,000 people over the age of 65, 24,000 disabled children and adults, 146,000 young adults, 85,000 parents and caretakers, 149,000 children, and 11,000 pregnant women. And those numbers up, we can see that these cuts will hurt roughly 500,000 people within my district alone. That's almost half of our district. There are real people who will lose more than $5 million in Medicaid benefits and the services they rely on. I can tell you that you'll see similar disturbing figures across this nation. Republicans continue to rob Americans to fill the pockets of the rich, and their actions are costing lives. Democrats will continue to fight back by holding Republicans accountable. And let me just close with this. Human beings are human beings. They are born into this world without party affiliation. This is going to impact all Americans, all of us. The cascading effect of cutting $880 billion out of healthcare will not only mean the threat to our health and well-being, it will mean higher unemployment. It will mean the closure of hospitals and federally qualified healthcare institutions within our communities. It will mean devastation at every turn. We have just recovered from a pandemic. We're seeing the outbreak of measles across this nation. This is not the time for the most wealthiest in our nation, the top 1%, to line their pockets at the expense of the health and well-being of the people of the United States. It's time to stand up. It's time to fight back. It is now my honor to bring to the podium at this time Shashina Salvador, one of the constituents of the 8th District, who has her story to share with you today.
Thank you. Good morning, everybody. How are you guys? Thank you, Jeffries and Congresswoman. My name is Shashina Salvador, and I live in Gravesend. I'm also a single woman and a mother to this amazing 2-year-old Aviana, who just celebrated her birthday. I am also a Massachusetts National Guard veteran, and I am a member of Moms Rising. Thank you, Leaders Jeffries, for all you are doing to fight for working families like mine and for the opportunity to share my story today. My family depends on Medicaid to stay healthy, and I am horrified that this critical program is under attack. I first enrolled in Medicaid when I was pregnant with Aviana. At that time, I was working at a child care program, and I did not have health insurance. Medicaid made all the difference for me. Because of Medicaid, I was able to access the prenatal care I needed to maintain a healthy pregnancy. I didn't have to avoid going to the doctor or skip filling prescriptions for fear I couldn't pay. I could deliver my daughter without worrying about going into deep medical debt. And I'm not alone. Nearly half of the births in New York are covered by Medicaid. Since Aviana was born, Medicaid has also been critical for her health care. Medicaid is the reason I can take her for all her checkups that support her growth and her development. It also means that if I'm worried she's seriously sick, I can take her to a doctor. What could be more important than keeping our nation's kids healthy? I can't tell you what it feels like to watch your health care and your baby's health care get debated in Congress like it's a political chess piece. But I can tell you, I feel like Republican lawmakers have their priorities upside down. Billionaires don't need another tax cut. Families need health care. I'm counting on lawmakers to stop playing games with programs like Medicaid and focus on real problems. Problems that are holding our families and economy back. Like the child care crisis. I had to leave my job at a child care program because I could not afford child care. We barely scraped by, and I used to squeeze in DoorDash shifts where I could. Right now I work weekends and care for Aviana during the week, and I'll do almost anything to provide for her, but it's exhausting. In short, Medicaid is God sent for my family. I have no idea what we do without it. The thought of losing Medicaid is chilling. So instead of slashing funds or proposing more burdensome work requirements for Medicaid and SNAP that would punish caregivers, let's invest in the care infrastructure that parents need to be in the workforce and provide for our families. I'm so grateful for Leader Jeffries and Congresswoman and everyone here today for standing up for Medicaid. The program is essential for families' health and well-being, and moms like me